Shade matching with porcelain veneers. It's easy if you're doing 8 to 10 porcelain veneers on a maxillary arch, especially if you're doing the upper and lower anterior teeth with porcelain veneers. But what about those critical shade matches? Central incisors, lateral incisors, when you're not restoring the adjacent teeth. Okay, so the first thing I'm going to do is take photographs of the shade guide with the appropriate shade. This B1 shade tab is the shade that most closely matches the adjacent teeth. If it's a critical shade match, I'm never going to do one central incisor. Whatever I do to that central incisor, however I restore it, if it's a broken tooth, whatever the reason, I'm going to do the same thing to that tooth, even if it's a perfectly healthy tooth. Why? I've worked with the finest porcelain technicians in the world, and they say to a person that it's almost impossible to match a single tooth in the aesthetic zone, especially if someone has a high lip line. Then once I prep the tooth, I'm going to take another photograph with the stock shade tabs so the technician can see the shade of the stump shade of the tooth that he's having to cover and hide with the veneer. I want most of the hue, chrome, and value of the veneer to be determined with the veneer, not with the cement. The cement can influence the final hue, chrome, and value, but I don't want a translucent veneer in very many cases. I want some opacity, some character in that veneer that determines the final outcome. Now, this is the critical part. I don't ever use try-and paste because the shade of the cement is not determined until it's set. Place the veneers on the teeth and see how they look on the teeth with no cement. If the shade is perfect, then we're going to use a translucent cement. If they're a little too light or a little too dark, I'm going to use either a little lighter shade cement or a little darker shade cement. So in this case, these veneers are just about perfect. So I'm going to make a little pledget with the A3, A1, transparent, B0.5, and white opaque. I'm going to squirt little dollops of each of those shades on the countertop and cure them, because that's the only time you know exactly what the shade, the hue, chrome, and value of the cement is going to be. So I've narrowed it down to these three by eyeballing it, and now I know this one's too dark, so it's between the B0.5 and the transparent or translucent. And I'm going to put these on cotton tip applicator sticks with transparent or neutral wax. You don't want a colored wax because that can influence your eye when you're determining the shade. Then I'm going to hold those tabs up next to the prep teeth. The shade was very good with the veneers alone, but I might want to influence it just a tiny little bit with a little lighter cement. So this is my final selection, which is transparent or translucent. And here we have it, the cemented veneers, and you can see we have a very nice, harmonious shade match. And you can do this every time if you'll use this method. Now, one of the keys is you want the porcelain veneers to be very close when they're delivered from the lab and you're trying them on the teeth. If there's a big discrepancy in shade, take a photograph of those veneers in place, take another photograph of the stump shade, email that to your laboratory technician. Be sure you have a fantastic camera. If there is a big shade differential between the veneer and the adjacent teeth when you try it on with no cement, don't cement it. This technique is for cases that have just a tiny little variation in shade and you want to influence it just a bit with the cement. And that's the Dental Minute.
Thank you all so much for joining us on this week's episode of the Dental Minute. Make sure you go ahead and press subscribe right there and join us next week. We will be talking about securing denture with mini implants at the time of tooth extraction. You won't want to miss it. See you next week.